What is concussion? Concussion describes a brain injury where, after an injury, there are functional changes that occur in how the brain works but no structural damage can be seen on standard imaging tests like CT scan. Mild traumatic brain injury, or concussion, can be defined as a short-lived loss of brain function due to head trauma that resolves spontaneously. With concussion, function may be interrupted while there is no structural damage to the brain. What causes concussion? Readers' comments 46 Share your story. The brain floats in cerebrospinal fluid and is encased in the skull. These protections allow it to withstand many of the minor injuries that occur in day-to-day life. However, if there is sufficient force to cause the brain to bounce against the rigid bones of the skull, then there is potential for injury. It is the acceleration and deceleration of the brain against the inside of the skull that can cause the brain to be irritated and interrupt its function. The acceleration can come from a direct blow to the head or face, or from other body trauma that causes the head to shake. While temporary loss of consciousness due to injury means that a concussion has taken place, most concussions occur without the patient being knocked out. Studies of football players find that most of those affected were not aware that they had sustained a head injury. Any loss of consciousness is considered a strong warning sign of concussion. Other serious symptoms of concussion include vomiting, convulsions, seizures, or drowsiness. Read more about sports and concussions. What are the types of concussion? All injuries to the brain are potentially serious and devastating. Historically, attempts to decide what symptoms could define a concussion as more or less severe and serious have not been able to adequately describe potential risk or guide the care provider and patient as to when the brain is fully healed. Concussions in sports are more easily studied than in the general public because of their frequency and the numerous studies on their evaluation and treatment. At present, it is reasonable to think of only one type of concussion, since the mechanism is to shake the brain. More importantly, it is important to recognize that there can be a broad spectrum of symptoms and severity for concussions and understand that most concussion symptoms will resolve themselves within a week or 10 days. Picture of the brain and potential brain injury areas. What are the signs and symptoms of concussion? Readers' comments 9 Share your story. The signs and symptoms of concussion may be obvious or very subtle. Most patients are unaware that they have sustained a concussion and may not connect their symptoms with a head injury. This is especially true when symptoms develop hours after the initial injury and those events may have been forgotten. Being knocked out, loss of consciousness, or having a seizure after a head injury are not common and may be very dramatic, but these two symptoms do not predict the severity of the concussion. Symptoms like mild confusion, disorientation, and irritability are most commonly seen. Symptoms tend not to be objective and may be hard to describe or be appreciated by the patient. Often it is family members or friends who are more aware of the situation. Typical symptoms of concussion include: because of all of the above, students may suffer a drop-off in their schoolwork and grades, while adults' work performance may suffer. Physical signs. The purpose of the physical examination is to look for abnormalities that would point to bleeding in the brain or to a neck injury and spinal cord damage. The neurologic exam in patients with concussion should be normal. How is concussion diagnosed? Physical examination and testing. Taking a history of what happened to the patient is the important first step in the diagnosis and treatment of a concussion. Understanding the mechanism of injury and the sequence of events afterwards is important in deciding the potential risk for bleeding and swelling in the brain. The history will try to find out if there was an underlying medical problem that caused the injury. For example, in older patients who fall and hit their head and are briefly unconscious, the question becomes, did the patient hit their head and get knocked out? Or did they pass out due to a stroke or other problem, then fall and hit their head? Medications and past history are important considerations. Patients who take blood thinners like warfarin, Coumadin, or dabigatran, Pradaxa, are at higher risk for bleeding when they get hit in the head. Physical examination will include a complete neurologic examination and may include looking for weakness, paralysis, or change of sensation in the body. Balance and coordination may be evaluated. Vision and hearing may also be checked. The head will be examined looking for signs of injury including the potential for skull or facial bone fracture. The neck may also be evaluated since neck injury can be associated with head trauma. The concept of minor head injury refers to patients who have had trauma to their head and are fully awake. The question becomes whether a CT scan of the head is needed to look for bleeding or swelling in the brain. Rules have been developed to guide the healthcare professional and allow the appropriate use of CT scanning. Both the Canadian CT head rules and the New Orleans rules are effective in screening patients who have had a concussion but do not need an operation. The Canadian CT rules suggest that a CT is required only if any of the following criteria are met. Please note that these criteria apply to patients aged 16 to 65, high risk for neurosurgical intervention. Glasgow coma score less than 15 at 2 hours after injury. *C below. Suspected open or depressed skull fracture. Any sign of basal skull fracture, blood behind the eardrum, raccoon eyes, or